happy to say I have one of those wonderful, open-minded, I would say she's an artist, but let her tell you what she does. Her bio is incredible. I think this woman is probably 200 years old. She's been a professional student and a professor, and she's done just about everything in the field, and I am so honored to have her here, Dr. Sharon Norling.
Yes.
Welcome, Sharon.
Well,
Yes.
thank you, and I'm really happy to be here today, and this is a great group, and we'll have a lot of information and fun.
Yes, yes. I'm sorry I called you Sharon. I don't know you that well, but doctor, let me get back to the doctor part because I want to keep it above board here. I have found that over the years, my feelings towards doctors per se has reached a new height of respect, only because I know the challenges that some of them have. I know that the job itself is extremely stressful. It's not only all the years that you put in, then you have to deal with people that are looking for answers and hope and please save my life type of situations. And that is something that not everybody is capable of doing. So reading your bio last night, I was very impressed that you have done so many things for women and that you are a woman. I always love the fact that a woman reaches that place in life where I could say, hey, she got there. Because I know that it's a man's world still, even in the doctor field, totally.
Any field.
Any field, that's correct.
Right.
And you mentioned that you were a nurse to start off with, and I love nurses. I love nurses. I dated a few, and they were fantastic. They were fantastic.
I was going to say, that's another show, though. That
No,
part of
it's
the
just that
stuff,
they've
huh?
seen so much.
Yes.
And then when they go out, they love their little cocktails, they love to dance, and I'm a big dancer. And yeah,
He's
seriously.
a good dancer, by the way.
Did I date you?
No! anytime. I'll have to talk to your husband about that. But you basically are now doing integrated medicine. I love that word. That's it's a full, broad spectrum word, and I want you to tell us a little bit more about that, because I know that there's many disciplines out there attached to the medical profession. But let me give you the floor. Tell us what you're doing now with this integrated medicine.
Okay. Well, I kind of go back to, I'm board certified MD.
Right.
And then I was recruited to teach at the University of Minnesota in the medical school. And while I was there, I really got involved in integrative medicine and the natural approaches to health and healing.
Right.
So it was a new field for me 13 years ago, but we were teaching it in the medical school, and I was so struck by the dynamic research that's out there and the effectiveness of using something that's natural, that is equally as effective, sometimes more effective, without any side effects.
Ooh.
Instead of always using, the drugs, the pharmaceuticals, or surgery. And sometimes we do need the drugs. Sometimes we do need the surgery.
Let me just ask something before we go on. Integrative medicine. What exactly does that mean?
She's getting to it. She's
Oh,
getting
okay.
to it. Yeah,
So she
she's
was
giving
using
us
it,
a
she-
little.
okay.
Yeah. I already
I
asked.
guess I'm getting excited about it.
It's a good question.
Yeah, relax.
It is a good question.
Yeah.
And integrative medicine is actually taking the best of both worlds.
Ooh.
The best of conventional medicine
Right.
and the best of natural healing approaches. And it has a different paradigm to it. In as much as in integrative medicine, we're looking at the whole person. We don't look at a sinusitis or a headache or, GI disturbances or body parts. We look at the whole person because it's really all related. Yes. And actually, when I was at the U, I used to tell my medical students and residents that a woman is more than a pelvis.
I love it.
They really are a whole person.
That's good.
And so in that way, we look at the whole person. Right. We also look for underlying causes of an illness in a different approach as compared to conventional medicine. So we really blend both. And then we partner with our patients. And they really participate in the decision making. And so it's a very collaborative and I think dynamite field. And there's lots of good leaders in this field. For example, when a patient comes to see me, before they come, I will actually interview them on the phone, and they will fill out a very extensive health assessment form, about 16 pages. And I always tell them, don't be overwhelmed by a lot of its check marks.
Right.
Then when they come in, I spend at least an hour to an hour and a half with them.
My God.
And I have them bring in their medical records. and if they're taking supplements or vitamins, bring in the actual jars. We'll sit down and talk about that. So the educational component is important.
Very.
And that's really what people want to know. And they want to be listened to. Because I've found the average in the United States for an MD's time with the patient is 7 to 15 minutes.
Right.
And I have found that there's a story behind the story.
Sure.
Well, and also, the patient is also, it gives them the opportunity, they're taking responsibility for themselves and what's going on within them. And so then they're more of an active participant. I think a lot of times you think, well, I'm going to go to a doctor, he's going to fix it, or she's going to fix it.
But you're also a detective, and you've got to get all these clues and information up front to make a better decision.
Yes, because a person can come in with multiple symptoms, and whether it's fatigue or difficulty sleeping, a headache, sinusitis, heartburn, GI disturbances, or irritable bowel, or joint pain and that muscle stiffness, anxiety, depression, they can all be related to one thing.
That's true.
And so that's why looking for that one component that may be inflammatory and finding that out, or if it's a neurotransmitter imbalance or a hidden food allergy, and we find that out and then resolve that for the patient with their participation, we have dramatic results.
You know, it's fascinating because you're talking about something that I am so happy that in my lifetime there are people like you out there. Because seriously, I always thought that it was one way or the highway. And I'm talking about in the 90s, the early 90s, when Scott and I met and we embarked on my environmental, at that time it was just a dream, and created an industry. I would have to say we pioneered it.
Well, we created our own jobs.
Yeah, but there was not many people like us out there.
Right.
Seriously.
And
still the good ones are very hard to find. But in the field of medicine, because I mentioned before, there's so many disciplines. You have now the chiropractors, you have the acupuncturists, you have, to a certain degree, the chiropractors. I mean, they have to study. They have to study the body. And I really have to tip my hat to those like yourself that have taken the time and learned not only your trait that you basically went to school for, and you have that beautiful thing on the wall saying I'm an MD. I mean, that has to be very proud. You got to be very proud to be in that exclusive club. And then to go back to school and say I want to do this because I want to give more. Jesus, I tip my hat to you. I tip my hat to you because that really takes
time. But how
time.
can you do that in this age where insurance companies reimburse you probably for 6 minutes of time with the patient, and you're spending all this extra time
with the patient?
That's interesting, yes. That's a good
and that's
point.
a very good question, because we actually don't bill for insurance. What we do is we give the patient a super bill with all the CPT-9 codes, ICD-9 codes, and CPT codes. So, and all the information that they need to submit it to their insurance company. So I'm considered an out-of-network physician. And depending on the various insurance companies, they will reimburse anywhere from 60 to 100%.
Really?
So for me, in our holistic center, that feels better for me.
Sure.
Number one, I'm not tied to what the insurance company's time frame is for my practice when I'm caring for patients. Secondly, I don't have to get approval from insurance companies on some of the diagnostic testing that I'm doing. I had a cute, darling 75-year-old woman in the other day, and I was explaining, about this, and she said, well, you know what? I don't care. I have insurance. She said, I'm 75, I'm supposed to, they don't know it at work. I'm still working. She said, they think I'm 65, but I don't tell them. And so I have insurance, but you know what? I'm not going to have that 19-year-old from Nebraska telling me what I can do and what I can't.
Yeah.
She said, so I just want to pay for it, because you know what? Nothing is more important than your health.